questions. I wanted to make this big. Let me see if I can do this. Make it bigger so I can record. Okay, so this is cancer care that we're going to be talking about. And I'm just going to talk about like health promotion and disease prevention. And you've probably had a lot of this when you were in fundamentals, right? Everybody should be eating healthy. You should be eating a diet that's low fat with fruits and vegetables. And when we're talking about fruits, you want to eat fruits that have like antioxidants, like berries. Okay, those are very good for you. You want to have a healthy body weight. I saw on a lot of your practice assessment focus reviews, you outlined the healthy body weight, and it's true. You want a BMI less than 25. So 24.9 would be the top end, 18.5 would be the lower end. That's healthy. That's where you want to be, right? You want to limit sugar in the diet, nitrates in red meat, avoid smoking and tobacco products, limit alcohol. Women should only drink, if they're going to drink, 1 alcoholic drink per day. And that's real important to know. Just 2 alcoholic drinks per day can lower your immunity and make you more prone to things like cancer. Okay. And you want to protect your eyes and skin from the sun. From the sun. Skin cancer is usually caused by being out in the sun. So you don't want to have any kind of exposure to the sun. You want to, stay in when it's really bright out during when the sun's shining the most, but also make sure you're wearing SPF 30. It has to be 30. Okay. And then don't go in tanning beds. You have to use, if you need a tan because you're going someplace special, get a spray tan. That's what you need to do. All right, so avoid risky behavior like alcohol. If you have funny looking moles, make sure you take care of those, get them removed. Avoid radiation, so also the sun, and get immunized for hepatitis B. Hepatitis B is a virus which can eventually lead to liver cancer. So it's very important that immunizations.
Hepatitis B, is that what the newborn get?
Yes, they do. But that wasn't invented when I was young. I had to get the series when I was an adult. Yeah, so true. They do get that. And HPV as well. Teenagers get that. Okay, so those are 2 immunizations they can get. All right.
So HPV is that you can get the cervical cancer, right?
Yes, true. Very good. Very good. All right. And then, everybody needs to get screening. So an annual mammogram if you're over 45, and a breast exam every 3 years if you're age 29 to 39. Okay. Colonoscopy at 50, and then every 10 years. Fecal blood testing every 3 years. And that's usually highly tested on proctored assessments, like what the nursing implications are for that. Prostate, men need to get checked when they're 40, and we'll talk more about that in Med-Surg 2 when you go there next semester. Okay. Age is a risk factor. The older you are, the more prone you're going to be to get cancer. If you're immunosuppressed, like people that have had kidney transplants and they are now taking these medications to stop the body from rejecting the kidney transplant, are going to be at risk for cancer. Okay. So those are I talked about sun exposure, tobacco, and alcohol. Okay. Again, Hep B is a risk factor. Hep C is a risk factor. Hep B has an immunization, so you need that. We talked about HPV. We'll talk about HIV for the next exam in Kaposi sarcoma. There are cancer markers. Those are blood tests they can do. So with cancer, patients can become very malnourished. So what happens is cancer cells are dividing quickly and they're growing quickly, and this increases the metabolism. So somebody could have unexpected weight loss, which is something we all dream of, but really it's not a good thing, okay? So they can also have impaired absorption in their gut, And then cancer treatment like radiation and chemotherapy can cause anorexia. Okay, so that all those things can contribute to malnutrition. So you want to make sure you're encouraging oral hygiene. So before they eat, you want to offer to rinse out their mouth and clean it after they eat as well. Rinse out their mouth. You want to limit liquids during meals because you don't fill up on liquids. Okay, these
Yeah.
labs, pre-albumin this is the most sensitive lab for malnutrition, and albumin is also a good thing to watch for. Now, we haven't talked about this yet, but people with cancer and cancer treatment are going to be at risk for constipation, but also at risk because there's an oncological emergency in certain kinds of cancers. They may get a very high calcium level. So they may get constipated. When you have high calcium in your body is going to be constipated. So anytime somebody's constipated, I read this on a lot of focus reviews as well, encourage fiber and fluids first before you start the stool softener, give a laxative. What's that? SIADH, have you heard of this?
No.
Okay, it stands for Syndrome of Inappropriate Antidiuretic Hormone. Okay, so that means that there's this antidiuretic hormone floating around the body, which means the patient is going to hold on to water in their body. Okay, so they're going to be soaked inside. That's why I have this as red, soaked inside. Okay, their sodium is going to get very low, and this can cause seizures and muscle cramping. Okay, the reason the sodium gets low is because the water stays within the vascular system, so it gets hemodiluted. All right, so they're going to have orthostatic hypotension, increase intracranial pressure, and what they do about it is they put them on a fluid restriction. Okay, so their sodium will come back up. Hypercalcemia, you really need to know a lot about hypercalcemia. So there's a saying, bones, moans, stones, thrones, and psychiatric overtones. Okay, so that means calcium is like a sedative to the body. Okay, it slows everything down except for the kidneys, and I'm going to explain. And this is important. They have bones, they're going to get pathological fractures if they have a high calcium level. For moans, they're going to be constipated because calcium slows the body down. So it slows the bowel down, so they would have constipation. They will also get anorexia from that. They get stones, so if there's too much calcium in the body, the kidney's going to form kidney stones. Thrones. So thrones means patients with increased calcium, it's going to cause the kidney to put out a lot of urine. So they're going to have increased urine output. Okay, so this is the only thing that like really increases in hypercalcemia. They're going to have increased urine output and constipation. Okay, they're also going to be like apathetic and be depressed. Okay, that stands for psychiatric overtones. That's how I remember the signs and symptoms of hypercalcemia. All right, so treat it, they're going to give them lots of fluids. That's how we treat it, and they'll get a diuretic called furosemide.
Oh, we give lots of fluids?
Lots of fluids, yeah, you want to flush out that calcium. And remember, the effect of calcium on the kidney is that they're going to have an increased urine output. So the patient is going to lose a lot of fluid due to the high calcium level, right, through the urine. So you want to make sure you're replacing fluid.
Okay.
So the patient doesn't get dehydrated. Now, there's another oncological emergency that can happen to cancer patients 3 to 5 days after they have chemotherapy. So tumor lysis syndrome means it's really a good thing in a way because it means the chemotherapy is working. And what it does is the tumor cells are going to bust open, they lyse, right? And out comes the potassium, the phosphorus, and the uric acid. They leak from the cell. You've got to know that, okay? You got to know what's up and what's down in tumor lysis syndrome. right? Because potassium, phosphorus, and uric acid live inside the cell. But when the cell busts open, it lyses, all those electrolytes are going to leak out of the cell. Okay.
Okay.
Now, anytime phosphorus goes high in the body, calcium goes low. So they'll have low calcium levels. So you have to know that. Anytime somebody has a high or a low potassium, they are going to be at risk for dysrhythmias. Okay, that's what you're worried about when somebody has a high potassium. So it has to be treated quickly. So they're going to get fluids, and they also get medications to lower potassium, uric acid, and phosphorus. Now, another oncological emergency can happen to people like lymphoma or lung cancer. What happens is a big tumor grows and presses on the superior vena cava, which usually brings blood from the upper body down to the right atrium, down to the heart, right? So over time, the body is amazing. It starts making all these collateral vessels because the flow of blood is hindered through the veins because the tumor is obstructing it. Okay, so that's why people with SBC syndrome have all these veins that you can see. Okay, their skin is going to be cyanotic. Okay, and so they will also get a lot of bloody noses. So that's another emergency. So what you have to do, their face and neck are going to get all swollen and they have edema. So you put them in high fowlers so that they can breathe, put oxygen on them, remove jewelry and tight clothing. Now, spinal cord compression is important, and I'm going to tell you why. Spinal cord compression can happen to people with cancer when the cancer metastasizes to the spinal cord. And how you'll know that this has happened is patients will start complaining of low back pain. And the low back pain is going to last for a long time before they have neurological symptoms. So your job is to recognize it if they have low back pain and report it, because once they have neurological symptoms, they may not be able to regain function of their limbs. Okay, so that's really important. So they may suddenly not be able to move. They may suddenly have, incontinence that they haven't had before. Okay, so that's a sign of spinal cord compression, but you want to catch it when they have low back pain. All right, so we always want to engage in healthy activities so that we don't increase our risk. We want to engage in screening and early diagnosis. That's really important, okay? Now, to detect cancer, there is a mnemonic. It's called caution, okay? And you need to know what each one of these stands for. So C, a change in bowel or bladder habits, a sore that does not heal, unusual bleeding or discharge, thickening of the lump, indigestion, and that indigestion could mean they have laryngeal, GI cancer, so stomach cancer, obvious change in a wart and a mole, that could mean skin cancer, nagging cough or hoarseness can mean laryngeal cancer, and night sweats could mean lymphoma, okay? So you really just need to know what each of these letters stands for, okay?
Okay.
Now, one of the most definitive ways of diagnosing cancer is through a biopsy. And biopsy is an invasive procedure, okay? So you're going to need to get an informed consent, and I know you talked about that last week, okay? Now, a needle biopsy right here, this is where they inject a needle and pull liquids, either liquid or tissue or bone marrow, actually. Okay, so that's a bone marrow, that's a needle biopsy. Bone marrow is very painful, but they could get that too. Now, when they treat cancer, they can either remove the tumor, they can do a lymph node dissection at the same time. They can have chemotherapy, radiation, hormone therapy, and immunotherapy. We're going to talk mostly about chemotherapy and radiation. All right. So
actually, yeah, I'm
that?
sorry, but actually we didn't go through the cancer treatment.
Yeah, I'm going to go through it now.
Oh, yes, yes.
We're going to focus on chemotherapy. Okay. So chemotherapy kills fast growing cells quickly, okay? So cells in the mucous membranes, GI tract, hair follicles, and bone marrow. Those are the ones we're gonna really, focus on, okay? So patients that undergo chemotherapy get alopecia, which means baldness, okay? They get bone marrow suppression, and we're gonna talk about that. So immunosuppression is a complication, okay? So that if they have bone marrow suppression, they're gonna be at risk for neutropenia, anemia, and thrombocytopenia, okay? So with neutropenia, don't get them mixed up. It's really important you understand the difference between those neutropenia, thrombocytopenia, and anemia. With neutropenia, you have a low white count. What's that?
No, I just want to tell that the neutropenia is white blood cells, right?
Yes, it is, okay? So if your patient has neutropenia, you need to report a fever of 100 or higher Fahrenheit. The reason is because they don't have a lot of white blood cells, they're not going to be able to generate a fever. So if they have even a low-grade fever, that could mean they're very sick. You want to check their mucous membranes for signs and symptoms of infection and breakdown. You want to make sure their mouth does not get dried out, okay? Because that could cause like cracks in the skin. You want to always get cultures before giving antibiotics. So your nursing interventions include monitoring temperature, WBC, and absolute neutrophil count. You're looking for any kind of infection, okay? They need to be in a private room, and they must wear a mask to travel out of the room. You want to avoid all invasive procedures. Do not allow plants in the room. Do not allow them to eat fresh fruit.
And vegetables? No.
Yep. They can eat things that are really cooked and canned, okay? But they can't eat fresh fruit because that can carry, bacteria. They need to change stagnant water in equipment. You need dedicated equipment in the room, so keep a blood pressure cuff in there, stethoscope, so you're not bringing your dirty things into the room, and throw out drinks that have been sitting longer than an hour.
Yes.
Okay. With teaching your patients going home, you're going to teach them, and these are all important. You have to know these, okay? Avoid crowds and sick people. They need to take their temperature daily. They shouldn't work out in the yard and play with dirt, okay? They shouldn't change cat litter. They need to wash dishes in hot soapy water. Wash glasses after each use, remember, and don't leave water hanging around.
Yeah.
Wash the toothbrush daily in the dishwasher or rinse in bleach solution. And don't share personal items. Really important. With bone marrow suppression, they're at risk for anemia. Anemia places increased workload on the heart and lungs. So monitor for fatigue, pallor, that means paleness, dizziness, shortness of breath, and dyspnea on exertion. There's somebody at my door knocking. I will be right back, okay?
Okay.
I'm just going to stop recording, but